have the
Hi.
question.
Oh, do you want to go ahead and read the question for Elena?
Um, yeah, give me one sec here. I was really interested in this topic because, um, am I worried about her anonymity? You got no. Anyway, my daughter is doing great. She's thriving. She's at UCLA. She's a sophomore. But from time to time, she has said, Mom, I get this weird thing sometimes, and it really freaks me out where I feel like, am I me? Am I not me? Like, and she goes, and if I stay like thinking about it for too long, I get really distressed and anxious. And so I tend to just like turn to something to like distract me. Like she's into musical theater and she has a lot of friends
Okay.
and she likes doing other artistic stuff, and she writes songs, and that's usually how she gets over these little episodes. But I remember having that too as a younger child. Like for her, I was looking at the mean age of onset is like 16, and I think that is maybe the first year she said, "Ooh, something weird happened. I wanted to run it
Mhm.
by you." I remember having like some pretty intense feelings like that, like depersonalization, derealization
Mhm.
episodes that would literally last like maybe not even that long, like maybe 10 minutes or something, where I just sort of felt a little bit like detached from myself, and I had this weird, I
Mhm.
kept saying I'm me, but who's me? And it felt, like I majored in philosophy later, and I'm like, well, that's sort of just an existential moment, right? Like that's
Yeah.
wisdom. On some level it's wisdom, but yeah, so I was just anyway super interested in yeah, like this subject matter, because she had expressed some anxiety around it, and
Yeah.
otherwise doing pretty well. And it did make, and so then when it started to say it's often around early childhood trauma and stuff, and then my mind's like, of course, all activated and blown, like, what happened to her? I thought we did
Especially
so great.
as a parent, I could see that definitely being
Yeah,
something
yeah.
even
And
more.
so
Yeah.
it was reassuring to read that some smaller episodes like this are pretty predominant in the culture, right? Like I think it said something like
Yeah.
50% of the population has had some sort of experience with this. And then, anyway. So it did also, maybe it'll come up in our conversation, but in terms of like figuring out how clinically relevant it is in diagnosing a client, and finding out more through sessions. I did wonder, like, well, what is an average, more for the amnesia thing that she, and nor I have ever had, but it did make me think, well, how much of your childhood are you supposed to remember chronologically? Like I've never really, it's interesting. I've never really seen averages or like normative guides of like, are you supposed to recall everything since age X, or what
Yeah.
are you supposed to recall, and what
Yeah.
what qualifies as a block or a gap that's significant? I don't know. I found that
Yeah.
interesting too.
Well, that to me is interesting too, in terms of that's something that they didn't for this particular module 9, that we don't dive into talking about is it possibly PTSD, but or CPTSD type symptoms. But that, I mean, with doing the differential diagnosis, to me, there's definitely that kind of marker right there of is there, the dissociative amnesia of some sort of, PTSD type event happening.
Yeah, definitely. And it talked about combat veterans, which I thought was,
Yeah.
the most typically, almost expected, right? But what
Yeah.
I agree, like it at first it seemed like that was, they were making that correlation, but then later in the actual DSM it gave some statistic which is like PTSD rarely accompanies um one of the dissociative disorders. And I was like, really? Because I thought they were just talking about how it did often accompany it. So I should
Well,
clarify.
and the other one, okay, so to go into what I was looking at in terms of what maybe this might be going on with our client is that and this is what would have a question for John Lynn, and I looked up some of with adjustment disorder with anxiety.
Mm-hmm.
Is there the potential for the disassociation, or could that be a comorbidity type thing? Because a lot of these things mentioned that she has, within the last 6 months after ending the long-term relationship, moving, going to a new city, going to graduate school. And it seems like there's, gaps in her memory from childhood, possibly,
Right.
that it made me go immediately, okay, well, could that be adjustment disorder with this other kind of thing going on? And where I would be curious is if she, when she was younger, also did this, went through the
Right.
disassociation, but she doesn't remember it. It
Right.
would be interesting to talk, almost like say to her, or to the client, like, let's talk to your family. Did you experience this when you were younger? And, is this now a pattern that you're now aware of, that
Yeah.
during times of huge adjustment or huge change, you disassociate?
Yeah, I
So,
agree. Same. I had that jotted down of like, definitely wanted to know if this was something that was historic at all and had she
yeah.
had experienced before. Yeah.
Well, my other
Okay,
one,
should we jump into the questions?
yeah. Do you want to do it and reading the questions? I wrote down
Yeah. So
notes.
the first
Okay.
one is IDing the symptoms, right? Or you can read them because I have notes that are a little
Oh, yeah.
bit.
Let me, yeah, let me find my really quick.
Identify symptoms, uh, the
So,
dissociation versus the somatic neurological. And so, yeah, the disassociation one's disconnection from the body, watching from the outside, world feels different or unreal.
mhm,
Um, and then the more somatic, neurological, the weak legs, difficulty walking, the brief
mhm,
collapse, the body shutting down. Um, I suppose, and this is where careful intake and back and forth is important. Like body shutting down, I'm assuming pretty somatic, but that could possibly be a also derealization of like or separation between her body and everything else that she sees, right?
well, and that would make sense too with if she's afraid of driving, that's become avoiding certain activities. If
Mm-hmm.
driving, attending classes, all these other things, if she's afraid of another episode, it's so greatly affected her life
Yeah.
that now it's, altering this. She's 27, so, not that fairly young woman. It's altering her life in that drastic of a way that maybe there's somewhere that there is some more somatization that she's not giving a voice to, would be
Yeah.
my, she has a fear of it happening again. Well, exactly, would be pinpointing what is it. Your legs feeling frozen? Is she afraid when she's driving she doesn't know where she's driving to? That sort of thing. It would be getting more specific, I think, too, with what the actual symptoms are.
Mm-hmm.
Because,
Definitely clinically relevant in terms of the amount of occupational uh,
yeah,
impairment that she's experiencing for sure.
definitely.
Um,
um
okay, differential diagnoses um, from depersonalization, derealization disorder.
mhm.
Um, she has a lot of statements that certainly fit
Oh,
um,
definitely.
regarding her disassociation experiences. My feeling um, was that yet the focus for her really seems to be on the physical symptoms and episodes, um, which I think points to possibly the somatic neurological one being more around uh, the presentation of that being the more clinic the one of more clinical concern.
Well, and again, so that raises a question too of, is this something that she's experienced in the past? If not, in some ways, it sounds like maybe not, in terms of that she's really anxious. It says increasingly anxious that they are missing a serious medical condition.
Mm-hmm.
So then maybe this is something completely different than what she's ever, that she can remember experienced before, because she's kind of translating it as there's something not right in my body.
Right, right.
um which,
Which leads
part
to
and
the
part.
second one, conversion disorder.
Yeah.
I think we're supposed to call it functional neurological function symptom disorder. I hope I have that right.
Well, and in terms of, there are sometimes things that are not easily diagnosed.
Right.
I, for one, I have a,
Functional, sorry, just trying to get the terminology
no,
right.
yeah.
Functional neurological symptom disorder. Um,
Okay.
and what is interesting about that is, and I was led more there because the DSM says an associated feature of functional neurological symptom disorder can indeed be depersonalization and derealization symptoms. So,
See,
yeah.
yeah, and that to me, again, looking at, so I have a pituitary microprolactinoma and
What's
a,
that?
a pituitary microprolactinoma. So I have a tumor in my pituitary gland,
Oh, wow. Okay.
which goes and comes and has all sorts of different things. And when it starts to excrete prolactin, that changes your mood. It changes all these physical things that can happen though. With
Hmm.
it takes a very long time and like multiple diagnostic imaging, brain MRIs, etc., to diagnose
Wow.
because the tumor goes and comes, right?
I
So
see.
that to me would even be something of okay, you did the imaging, and I know the insurance and everything else sometimes doesn't do want to do repeat, but if it's something like that where you are having these other symptoms, it would make me go, okay, does she have other symptoms that aren't lactation, other things that make you go, okay, unrelated, but can be related for things that are like brain tumors
Totally.
um, that
Um,
have exhibit also the, mental illness type features of it.
yeah,
But it's over time. It's not for mine, it took a while for them to diagnose, you know.
exactly.
So it
Yeah.
was multiple MRIs, multiple, that kind of stuff, and keeping a list of what the symptoms are. So that would be one of the things in terms of treatment that I would want to work with her of, so we could rule out because my other one was looking at ruling out for the differential diagnosis, ruling out that it says distractibility during with manic episodes. So
Hmm.
really looking at, okay, is this something else completely? Is this like her, could it be bipolar or some other sort of thing that she's now going through these very distracted, very, disorganized kinds of things. I don't feel like it's that at all, but it is more this dissociative or even possibly into with adjustment disorder. But again, looking at ruling out, that was one of the things that ruling out distractibility during manic episodes.
Yeah. I'm looking at the ones that Jonalyn recommended on number two. Um, and
Let me
I
go
think
back
we're
up.
in agreement that um, because like you, I was actually I wondered if it was somewhat new language too. I was relieved to see that they were more like you were saying, hey, don't immediately rule out this underlying medical condition, especially when it
Exactly.
comes to neurological stuff, because that can be incredibly
Hard.
nuanced and complicated. And
Yeah.
so, like, I liked that they said,
Yeah.
you would need to be doing, they cited a number of different tests like lab studies, viral tears, electroencephalogram, vestibular testing, visual testing, sleep studies. And so when her doctor just says, yeah, everything's fine,
Yeah.
she's undergone neurological exams. Well, that's just her GP, I'm assuming. So I
Yeah.
don't even know if there's even been an initial neurological consult, let alone like further follow ups with
Mine was
specialists.
that, and mine was diagnosed by an endocrinologist.
Wow. Yeah.
Neurology looked at me and went, no, there's nothing.
Hmm.
Endocrinology was the one that finally went, oh, look, your prolactin levels are off, this and that are off.
Hmm.
And then they went to, okay, another MRI, and that. So it's like, again, not just doing that, we take it in terms of we're going to a neurologist for a brain issue, that sometimes there are multiple specialists even involved. That it can be, hormonal related. We're not just looking, with women, I think more in particular, also because this is a female patient that would be sending, to endocrinology and possibly be sending to, uh, if she's not pregnant, but I mean, going to not a perinatologist, but a gynecologist or someone else that specializes in women's metabolic panels looking at, different things that can happen throughout the course of your life with those changes
Hmm.
and the hormones. That could be something also to look at.
Hmm. In terms of comparing the functional neurological symptom disorder with the somatic symptom disorder, those are pretty similar. And what I was gleaning from comparing the two was that the conversion disorder, or sorry, the FNSD, um, I was saying there's no known neurological disease yet. The symptoms are consistent. Um, Disruptions in regulation of movement and sensation. Um, are they emerging during periods of stress? Did she even say that they were?
Well, that was,
That
see, and that was where I wrote a question down for myself, is it anxiety induced?
Yeah, that's pretty
Being
key
which
to as a
could,
follow-up, isn't it?
right? Because she has, and that's why I gone with adjustment, even type of disorder with type of some of the symptoms, because it's saying that it was over the past 6 months. She has
Hmm.
experienced several
Right,
episodes, okay, but
right.
within the last, and her primary care physician was the one that referred her. Um, da, 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 da.
So the somatic symptom disorder, similarly, so that's she's got significant psychological distress. She's got a preoccupation with her impairment of functioning. She's not driving, she's not going to class.
Yes,
Um, the neurological complaints are interfering with her daily life. Her focus, but I think the reason somatic symptom is not as likely as the former is because the somatic symptom disorder, the focus is on the psychological response to the physical symptoms as opposed to the physical
just,
symptoms. And it's
yeah,
disproportionate anxiety. But if she can't walk, of course she's afraid to drive. And it feels
exactly.
so specific. It's not like it's generalizing out into anything besides this leg thing, which under in the again going back to the DSM, they kind of name the functional limb concern, right? Yeah, functional limb weakness or paralysis.
I
So
didn't see that. Okay,
the specificity and severity of that really feels like functional neurological symptom disorder, or as we've already said, an actual underlying neurological illness with completely understandable anxiety related to experiencing it is it. And we're leaning away. I think I don't want to speak for you from
yeah.
anxiety disorder, panic disorder, or depersonalization, derealization disorder
Well,
as
and
being the main thing.
those can all be things. I mean, going through a traumatic, going through traumatic events on top of having, illness, on top of the fear of the illness occurring again, or the somatic symptoms of it happening at any time, would further just kind of like, it's kind of a cycle, right? That
Right,
you're
exactly.
afraid of it happening again.
Yeah,
Thus, it's like when people with PTSD, they're afraid of going through, being out in public and going through that feeling again. It becomes a self-fulfilling prophecy,
yeah,
that
it's
you're so
integrated.
afraid. Yeah. And
Totally.
that
Yeah.
seems to be kind of what she's probably doing by avoiding those things and, having that anxiety. It's kind of further perpetuating it. But there probably is some sort of underlying, would be just to keep going with, let's talk to more people that specialize in this.
Right. And as
um,
we've already said, like, do a careful trauma history and
oh,
find out
definitely.
about identifiable triggers to the episodes. Yeah.
Well, and in terms of looking at the past, that she doesn't have a lot of memories of the childhood. It sounds like, from what we're given, that there's not a lot of recollection of childhood experience. Finding out that past history as well of why isn't there? Could be just she just doesn't have, or it could be, somehow trauma related.
Yeah. Okay, so
Um,
three, she asks, why is medical evaluation important when assessing symptoms? Like Elaine's, we've already kind of touched on that. What types of conditions
Definitely.
would
Yeah.
clinicians want to rule out before diagnosing somatic or functional neurological disorder? I was saying brain injury, aneurysm, cardio issue, epilepsy, um, in addition to a neurological condition.
Yeah.
Um, and I think super important to screen for because of the specificity of her symptom complaints and possible psychological factors affecting other conditions, I guess. because
Well, and you're also and it's also like ruling out with like the encephalitis, the different also issues that are sometimes more like pathogens. So it could be even an illness kind of thing,
yeah,
not just the tumors and that kind of stuff. I mean, it sounds like that they did thorough blood work, but sometimes it's a repeat of other things. And my thing would say to rule out, seeing an endocrinologist, someone that's looking at the other panels to see is there, somewhere something off that it's affecting everything else.
right. I
Speaking
also think
from experience,
Mhm. I also think she hasn't it doesn't look like there's info from what's given on substance use. So that's another thing.
that would be a big, and that was one of the notes I had for an even trauma question number 4, and then also for 5 additional assessments. I had doing more of a workup in terms of substance use or anything else. Another one with also looking at the dissociative. I mean, there are certain components with that, with looking at, autism and other where you don't feel like you're in the place. My son always saying that he feels like he's not there, that he's a robot when he's in stressful situations.
Mm,
That, with him, that's where it more his Tourette's and his autism factors in, that his way of dealing with stressful situations is that he isn't there, that it's a robot doing it.
yeah.
um you can see the changes in him when he's disassociating, that it's
Yeah.
somebody else, and he's like, it's the robot, and you're going, okay. But that is, his masking, his, becoming functional is his way of, it's not me dealing with it, it's the robot. um
Yeah, well, there was a lot in the module this week about how to understand this more is to understand how functional these dissociative and somatic um, presentations are for
yeah,
clients, why they have implemented them really for so long. And
it's because of coping skills.
mhm,
Yeah,
mhm.
yeah, yeah. I mean,
That sort of speaks to the cultural thing. I don't know if that was a question this week, but I know sometimes culturally, it's easier, um, or not easier, but it's often more familiar to experience somatic stress or to
yes,
internalize and then present somatic stress than it is some of the intrapsychic stuff, right?
yeah.
So
Well,
I
it's
know
more
she presents with both, but like the fact that like she can't walk or whatever, like, I mean, that's something that's outside, frankly, of my scope of knowledge yet, but like
yeah,
how much sublimation can actually
yeah,
present that like with actually like, losing numb limb function.
yeah. Well, I mean, it's again, even with people in PTSD, with the flight or freeze, that you're
Mhm.
going through these somatization of fear, and that it doesn't sound like what she's experiencing. But again, doing a really thorough trauma history and trying to figure out, if there's some other thing here that's coming up.
Yeah,
And
because
that
as I
was,
think you were implying it at the beginning, but we do, and I wrote that down too, is that we do have within that 6 month sort of um, window that's pertinent to the presentation of her complaint. She broke up, she had a long term relationship breakup
yep,
and a
moved,
move to a totally new city and starting graduate school. So for me,
yeah,
that's like 3 to 4 new stressors
right,
all happening.
yeah,
You
yeah.
know,
That's within a 6-month period.
mhm.
Um, and again, it's sounding like she's going to classes, maybe driving more than usual, because
Right.
those are the, two of the big things that she's not doing is going to class and not driving. Those could also be big adjustments. If you're somebody that works from home and then now you're driving everywhere and walking across campus, um, those are, could be again big, huge differences in her daily living.
Mhm.
Um, Trauma, looking at question number 4 for trauma and stress, past relational experiences, being that, if it's somebody that has, let's say, been attacked on campus in the past, going now where you're walking all the way across campus at a new school in a new city could be something that could be really scary. Um,
Absolutely. Yeah.
so
And how,
looking at the yeah, that there's definitely a component to looking back and going, okay, is this somehow also it could be a neurological disturbance as, something, pathological on top of something else that she's experienced trauma wise was where I was thinking of it. That maybe
hmm
it's multiple things going on at once.
yeah. Yeah. It goes to show how, wow, just how much you have to try to fit into your sessions or organize your
Yeah,
sessions to know, like,
yeah,
okay, I'm looking at different tiers of the potential diagnostic, factors. And so I really need to spend some time talking about because how she feels about being in this new city. How is it,
exactly.
how's the loss of this relationship really affecting her?
hmm What
You
where
know,
did she come from before compared to where she is
exactly.
now?
Past
If you had a
relationships.
very
Mm-hmm.
insulated environment where you live with your
Mm-hmm.
partner and you didn't go anywhere. Now you're in a new city where you're going to a new school and all,
Mm-hmm.
if your world became much bigger all of a sudden, that could be terrifying.
Right.
On top of,
How does she
yeah,
resource herself now, if at all? And, as I said, easier is not the right word, but it could be that she is subconsciously choosing to be concerned about these symptoms,
yeah,
that because it's harder for her to actually answer some of those questions about her breakup, about her fears
definitely.
about school, about
Or
her, yeah.
family,
Hmm.
yeah, family trauma. That to me goes to question number, looking back at what we're looking at, going to question number 6,
Hmm.
that kind of dovetails into um, or excuse me, question additional assessments, meaning that we would be going through maybe sending out to additional doctors for more testing, doing the trauma
Hmm.
history, um, the family history. Um,
Yeah, medical records. You really want to be
yeah,
collaborative about, as we said before, further tests that really might, if that we don't ignore some truly neurological illness,
yeah,
um, just within the context of our scope, like, but reaching out and advocating for her to reach out more for further tests, or, like I said, has she even seen a neurologist yet? Or is
yeah.
it
Well,
just one
and
GP?
yeah, and with okay, and is there endocrinology work being done up? Are there, it could be sometimes that with related to thyroid issues that can cause memory impairment. So looking at the full list of what are the also, pathological co-occurring type things that could be happening.
Yeah.
The other, so question number 6, do we have a kind of preliminary?
What do you think? I drafted up a little things because I'm trying to get better at using the language she wants to hear. But I
I,
think you go ahead.
oh, you can go ahead. I mean, I was looking at still ruling out some sort of adjustment disorder and
Mhm.
looking at dissociative amnesia.
Associative what?
Amnesia.
Oh, okay. Um,
But I want to hear yours because that was where, and I felt like that wasn't exactly the best. Oh, in the
I'm
meeting
not
we
sure.
have
She doesn't say she has
10 more
lapses
minutes.
in memory, does she?
Well, that was why I felt like that wasn't an appropriate diagnosis necessarily, but the fact that
You wanted to know more, maybe about.
yes,
Mhm.
ruling out
Yeah.
um began okay, frequently intense. She because of the distractibility. Because it said even during our meeting that she was becoming distracted,
Right.
drifting off for a second.
Right.
So to me, that would be gauging how much of drifting off, and is she being able to recall back to what we were talking about.
Mm-hmm. Right. It didn't kind of follow up on then.
So I
Yeah,
wasn't
getting
sure
back.
like how much is she forgetting, or
Hmm.
again doing more like neurological testing in terms of are we having lapses in memory on top of the other symptoms.
So I took a crack at a beginning and I said,
Would you get it?
Elena presents with symptoms that need to be further evaluated within a neuropsychological context. Her inter and intrapsychic experience and description of depersonalization and derealization align with dissociative disorders. However, the severity and specificity of her somatic symptoms are clinically concerning and warrant further investigation medically and diagnostic collaboration. Her doctor reports normal findings on neurological exams and imaging, but we don't know if a neurological consult and lab studies have occurred yet, including, as I said, that they list like viral tears, electroencephalogram, vestibular testing,
Mhm.
visual testing. Elena reports collapsing in her apartment and her occupational impairment and fear is increasing, related specifically to this and other leg numbness and inability to walk affecting driving and attending school. So I said, since Elena's increasing anxiety seems to be focused and precipitated by this particular functional limb weakness, and since the associated features of functional neurological symptom disorder include depersonalization and derealization experiences as she describes them, an onset may be associated with stress or trauma, and Elena has reported both a breakup of a long term relationship and her move to attend a new school. These stressors could have contributed to the presenting symptoms and distress. Additional assessment of whether Elena's psychological dissociative symptoms increase or occur in proximity to her somatic episodes will help support a diagnosis of functional neurological symptom disorder. This seems at the moment to be the most clinically relevant diagnosis provisionally due to the specificity of her somatic experiences and distress about them. Further assessment of medical screening, sleep patterns, substance abuse, more detailed developmental, um, okay, I lost it. Developmental history, screening for anxiety, and possible trauma history will help guide further diagnostic questions.
That was wonderful.
Well, thank you. I kind of went by her little thing that she posted about Ben. So,
Yeah.
um,
No, that was fantastic.
but I think that kind of summarized what the two of us were just talking about.
You put a little bow on it too.
Um,
Perfect.
yeah, this is really interesting. This particular module, as I said, I just find really interesting because it kind of brings up sort of epistemological questions of like what is
Mhm.
normal memory and what,
Exactly.
uh,
Yeah. And
when you
how do
have
we gauge?
existential moments, is it immediately pathological or are
Yeah.
we just
And how do we gauge that when
yeah.
we all have different ways and no one has a necessarily some people remember from all entire childhoods. Other people remember from, snippets. So I love that. Well, and looking at dissociative identity disorder too, something that really fascinates me and looking
Yeah,
at, that kind of thing of is this a client that the next session we have is going to present as an entirely different person?
crazy.
Like, yeah.
Oops, I
So
shouldn't
it's
say
like,
that.
well, but
I
you know what I
meant
mean?
that colloquially, not clinically.
Yeah. Yeah, no, but I mean, but it's again something else to look at is she presenting, as different people even in that way? I mean, is it something that is that it not at all neurologically related and it is something that's
Mm,
a coping mechanism,
mm,
or more of that stuff fascinates me.
mm-hmm.
I know a couple people with DID and it's fascinating.
Oh, do you?
So
Wow.
so it's amazing. So how we cope, how we find ways to cope.
It is.
It's amazing. Our brains are so incredible. So yeah. But
Okay.
that was a great, it feels like great conversation. And
Hmm.
we are just under time. Do you want me I can stop recording?
Sure. You can, that sounds good.
Okay.